Hi students, this is Dr. Raghu, and in this video I will be discussing coagulation of blood. So by the end of this video, the students shall be able to answer these questions as to what is the meaning of coagulation of blood, what are all the factors which are involved in the coagulation of blood, and the mechanism of coagulation of the blood, which involves two pathways, the intrinsic pathway and the extrinsic pathway. Let's start with the first question, which is what is the meaning of coagulation of blood? So coagulation of blood is nothing but a process by which the liquid form of blood is converted into a jelly form. Okay, it is also called as clotting of the blood. So there is no difference if I say either clotting of the blood or the coagulation of the blood. And the mass of jelly which is formed, that is called as either a clot or it is also called as a coagulum. So I hope you understood this. The blood which is flowing in the blood vessels is in the liquid form. Because of some reason, this liquid form of blood is getting converted into a semi-solid jelly form, and this is called as the clotting of the blood. And the jelly form which is formed, it is called as a clot or it is also called as a coagulum. So there are so many factors which are involved in the process of coagulation or clotting of blood. So totally there are 12 factors which are involved in the coagulation of blood, and they are named as factor 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13. So there are, you might be wondering that I am telling 13, but there are only 12 factors, because after factor 5 there is directly factor 7 and there is no factor 6. Fine. So factor 1 and unfortunately students have to remember these factors, and you have to by heart these factors, because sometimes in the question they will ask you to name all the clotting factors. So factor 1 is called as fibrinogen, factor 2 is called as prothrombin, factor 3 is also called as thromboplastin, and you have to remember these names also. Factor 5 is the calcium, factor 4 is calcium, factor 5 is the labile factor, factor 7 is the stable factor, factor 8 is antihemophilic factor, factor 9 is Christmas factor, factor 10 is Stewart-Power factor, factor 11 is plasma thromboplastin antecedent, factor 12 is Hageman factor or it is also called as a contact factor, and factor 13 is fibrin stabilizing factor. Okay, now all these factors which I have mentioned, which will take part in the coagulation of the blood, all of them are in inactive state. They are all in inactive state. Okay, there is something which activates these factors. Okay, and remember that something triggers the activation of the factor. So what happens initially is that there is activation of only one factor. Okay, this becomes active. Okay, and this factor triggers the activation of the second factor. The second factor is going to become active, and the second factor is next triggering the activation of the third factor. So this is happening in a series. One factor becomes active, one factor is going to help in activation of the second factor. Second factor is active, the second factor is helping in the activation of the third factor, and this process of activation, which is occurring one after another, it is going to continue till there is formation of clot. Okay, till there is formation of clot. So such a kind of reaction which is occurring is what is called as cascade of reactions. What it is called? It is called as the cascade of reactions, and I want all of you to mention this in your exams. Okay, I hope you got this. So next, let's understand what is it which is going to activate the intrinsic pathway and the extrinsic pathway. As I have told you, there are two pathways, intrinsic and extrinsic. The intrinsic pathway is going to get activated whenever there is exposure of blood to the collagen. So remember, when the blood is flowing in the blood vessels, blood is not exposed to the collagen. The collagen is present in the basement membrane of the blood vessels and outside the blood vessels also. But whenever there is rupture of the blood vessel, what happens is the blood becomes exposed to the collagen. There is also damage to the endothelium of the capillaries. Hence, there is also exposure of the blood to the damaged endothelium. And one more factor which triggers the intrinsic pathway is whenever the blood is exposed to the glass. Whenever the blood is exposed to the glass. And what is it which is triggering the extrinsic pathway is trauma to the tissue. So whenever there is trauma to the tissue, there is a release of a substance which is called as tissue thromboplastin. So the reasons for activation of intrinsic pathway are different and extrinsic pathway are different. Include this also in your answers if you want to score better. Next, let's try and understand the mechanism. Let's start with the intrinsic pathway. So exposure of blood to the collagen has happened, exposure of the blood to the damaged endothelium has happened, or there is exposure of blood to the glass surface. So what is the first factor which is going to become activated? So remember, the first factor which is going to become activated is factor 12. Okay, and when it becomes activated, I write it as 12A. A here means it's an activated form. And for the activation of factor 12, we need two more factors. What are these? One is called as high molecular weight kinogen. We write it as HMW, high molecular weight kinogen. And the second factor which we need is what is called as kallikrein. Kallikrein. Now what did I tell you? I told you that one factor, if it becomes active, it is going to activate the next factor. So here we have activated factor 12. Now this is going to activate factor 11. Okay, and we have 11A. Fine. Now this activated factor 11, it is going to activate factor 9. And we have activated factor 9. And for this we also need calcium for this step. Now this activated factor 9, okay, it is going to activate factor 10. So factor 10, now this is activated form of factor 10. Remember, for this step we need calcium. We also need the presence of phospholipids which are produced from the platelets. Not only that, for this we also require activated factor 8. Okay, activated factor 8. So three things are required: factor 8, calcium, and the phospholipids. So now what is going to happen? What has happened now? Factor 10 has become active. So this is factor 10A. Now what happens is factor 10A along with calcium, phospholipids again coming from the platelets, as well as factor 5, activated factor 5. Okay, so remember these all things taken together. Okay, all these things taken together, that is activated factor 10, activated factor 5, calcium, and phospholipid. This is what is called as prothrombin activator. This is called as the prothrombin activator. So what does that mean? It is going to activate prothrombin. Okay, so this was our intrinsic pathway. Let's try and understand what is going to happen with the extrinsic pathway. So what is it which is going to activate the extrinsic pathway? Extrinsic pathway is activated whenever there is damage to the tissue. And damage to the tissue is going to release a substance which is called as tissue thromboplastin. Now this tissue thromboplastin is going to activate our factor 10. Okay, so here also there is activation of factor 10. Here also there is activation of the factor 10. So better I can write it like this. So factor 10 is become active, and here also we need the presence of calcium as well as phospholipids. Okay, so what has happened is both the intrinsic pathways as well as the extrinsic pathways, they are converging on one common factor. Now what is that common factor? That common factor is activation of factor 10, and activated factor 10, activated factor 5, calcium and phospholipid, together they are called as prothrombin activator. They are called as prothrombin activator. Now what is the function of this prothrombin activator? What does it do? It converts prothrombin into thrombin. Okay, so prothrombin is converted into thrombin. Now the thrombin which is formed here, it can also activate its own formation. Okay, so thrombin can activate the formation of prothrombin activator, and this is a very good example of what is called as positive feedback mechanism. Okay, now this thrombin which is formed here, it is going to cause the conversion of fibrinogen into what is called as fibrin monomers. Okay, now these fibrin monomers, they undergo a process of polymerization. They undergo a process of polymerization by which there is formation of thick fibrin strands. Okay, now these thick fibrin strands which are formed, they are not stable. Okay, they have to be stabilized, and this stabilization is done by factor 13A, that is activated factor 13. So at last what I am going to get is a stabilized fibrin meshwork is what I am going to get. So this is a stabilized fibrin meshwork. So how is this stabilized fibrin meshwork? It is something like this. So these are the fibrin threads which are formed, which are very much stabilized. Okay, and caught in this fibrin meshwork will be our cells. We will have RBCs caught in it. We will also have WBCs caught in it. Let me show it by some different colors. So these will be WBCs, and we will also have platelets in it. Okay, we are also going to have platelets. So these are the platelets. Okay, so this meshwork which is formed is what is called as clot. This is what is called as the clot. Okay, so this is how the mechanism of coagulation is going to take place. So I hope the objectives of this session are fulfilled and you have understood these questions. What were the questions which I told you at the beginning of the class? One is what is called as what is coagulation of blood. What are the factors which are involved? We have seen, and we have also understood one important concept which is called as cascading of reaction, and the mechanism in which we have seen the factors which initiate or trigger or activate the intrinsic and the extrinsic pathways, and we have also seen what is intrinsic pathway and extrinsic pathway, and where do they converge? They converge at the activation of factor 10, and from here whatever is happening is what is also called as the common pathway. So if they are asking you extrinsic also, you are supposed to start with that and come to factor 10A and write what is happening after that. Even if they are asking you separately intrinsic, again it will come down to factor 10. So ultimately your answer is going to end with the formation of clot. Okay, thank you for listening.